Have you been injured, seen a doctor, possibly even had imaging, and told that there's nothing wrong that they can find? Do you still hurt and not know why? Well, there are several common injuries that are frequently missed or even overlooked, and one of them is facet joint injuries of the spine. Hi, this is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation and fellowship trained in primary spine care. In addition to my training, education, and experience, I've been managing patients with injuries to the spine for decades. Now, this video series is not intended to be a replacement for sound medical or chiropractic advice, for diagnosis, for treatment advice, or even long-term recovery. But seeing the wrong doctor can result in an incomplete diagnosis, poor recovery, and/or no recovery. So let's jump in. This four-part series first began with what is a normal facet joint. That is what the spine joints are called. Part two, we discussed what happens to the facet joint that causes it to be injured and/or how is the facet joint injured. In this video, we're going to discuss treatment, specifically chiropractic treatment. And then in part four, we're going to discuss long-term recovery. That's called prognosis. So let's get started. A very, very, very common question that you might be thinking or that we hear a lot is, if I've been injured and I see a chiropractor, will it hurt? The answer is, if you see the wrong one, yeah, it can. Now, can it injure it? Well, possibly. So you do have to be careful who you see. You do want to see somebody who has the training, education to manage trauma and has the credentials for it, along with treatment options for the chiropractic management. So generally speaking, what do we have available to us for joint injuries? Now, this is not meant to be exhaustive, but there's basically three categories. Number one, you've got medical care, and a lot of the medical care, would consist of medication, possibly injections, things like that. The second type of care that you have available to you is chiropractic care. Chiropractic care has been shown to be valuable. And then the third option that you have is therapy exercises. Almost any joint in the body that is injured needs some sort of activity brought through it. So let's focus on chiropractic care. So we're going to be looking at this table right here where I've got a plastic model on there. And we're going to be using this for demonstration purposes only. So the primary goal with a facet joint injury is to reduce pain and improve function. So are there things that you can do to reduce pain? Yeah, there are. And hands-on treatment has been shown to do that. Other things you can do to improve range of motion because the joints have lost their ability to go through normal range of motion painlessly. So those are the primary goals that we want to have when we start. Now, the type of treatment that's delivered by the doctor of chiropractic typically falls into two camps. You can have the high velocity type adjustments, a lot of those that you'll see on social media videos, and they're dramatic. There's some shock value to them. And if you've been injured, like I have been in my own personal life years ago, you may not want that to be the form of treatment. We understand that. And in fact, the research would support that's not what you should have. So this treatment right here is called low force. So this piece of equipment is one of the common pieces of equipment that we use for somebody who's been injured. So if we look at this plastic model right here, we've got the base of the skull laying on the face piece where a patient lays face down. And here's the individual bumps on the back of the spine that you can feel if you run your hands down there. Those are called the spinous processes. There are muscles that attach to those, so you can feel the muscles right through there. So one of the most common things that feels very comfortable for a patient after they've had a facet joint injury is where you stretch and open up the joints. That's called distraction. So with this equipment, I can grasp the front end, I can grasp the joint, and we can start pulling, distracting, moving the joints. This plastic model, of course, does not flex as well as a live human being, but you kind of get the idea. Additionally, we need to go through side bending. We can incorporate that in there, working through those ranges of motion. And we always work with something that's called patient tolerance. The patients have to tolerate it. It has to feel good. It has to be relieving while we're doing it at the time. Secondly, in addition to the side bending, we can combine that together with the distraction. So we can do side bending under distraction. Next, we can also add in what's called circumduction, where it goes back and forth like this, kind of in a figure eight pattern. And then last but not least, the table can also flex up and down, so we can add that direction in there. As the neck flows into the upper back, we can contact on the different sides, go through different side bending motions around, crisscrossed like that. We can work our way down into the low back. This video does not allow me to show you the lower back, but the same principle applies. The bottom section can bend and move. So this is a very clinically effective, low force form of treatment that very commonly, once patients are cleared from their imaging where they don't have any significant pathology that would prevent them from having hands-on chiropractic care, we could start doing it. So it's safe, it's effective, patients enjoy it, and it does reduce the pain. Now, there's other things that can be done for care, and it's self-care. When you think about it, you're only in the doctor's office a few minutes out of an entire week. The rest of the time, you're living with your own injured tissue. So you have to be doing some sort of physical activity. And most of the time, our counsel to patients is you begin just with the activities that you have. You don't necessarily add anything new in, but you need to recover your basic ability to walk around the house, bend over, pick up laundry, do things like that. Just reintegration back into your day-to-day activities is vitally important. So what does the research show in terms of chiropractic care for spine injuries? I'm going to use an old study. It's from 1996. It was written by a Dr. Woodward. He was with the orthopedic surgery department in Bristol, United Kingdom. And they looked at patients that had actually undergone chiropractic care. And their conclusion for patients that had chronic pain with chiropractic care was that 43% of all patients that are injured will still suffer at some point and not make a full recovery. So understanding what helps acute and chronic care is very valuable. So they did a retrospective study looking back, and they found that in their patient population that they studied, approximately 90% or a little bit more all had favorable improvements in their pain and in their function working and treating with chiropractors. So that's just one study. There's many more out there. There's some that are even older. There's some that are newer. So this is the reason why I chose this one, is that this is not something new. This has been around for decades. Providers that have followed the research know that chiropractic treatment is a valuable and effective role. It's not the only role, but it's a very effective and valuable role in the management and recovery and even sometimes pain management for chronic patients that have been injured in a motor vehicle crash. So thank you for taking the time to watch this video. You have plenty of videos to choose from. You chose this one, and I am honored. Thank you so much for watching. Watch the rest of the videos, and until next time, be blessed.